Yeah, that's one of the big things that we've been talking about this noon, and we're going to continue to get into that now. With reaction on the historic healthcare vote is Henry Ford Health System CEO Nancy Schlichting. Nancy, I know this has been a busy day for you, like the rest of us here, not only in their state, but across the country watching it. This comes down, you see it. How is this affecting you here and all of us locally in Michigan?
Well, we were thrilled because clearly this legislation provides access to care for 500,000 people in Michigan who don't have that access today. And at Henry Ford, we're a safety net provider. We have a lot of uncompensated care, about $220 million a year, and we provide needed access for people who basically are uninsured.
That was a big concern, right? Is the big drain in the healthcare system is this uncompensated care, and I assume a lot of it comes through the emergency room, correct?
Absolutely.
So you're saying that by people having to get coverage here, and again, it was ruled down in the Commerce Clause, they can't be required to do it that way, but if they don't buy it, they can be taxed. So by having these people covered, ultimately, will it also save the money, or save the hospital money?
It will. It'll also save business money. I mean, I think there's a part of this that people really don't understand, because if you spread and have everyone in the game, it really allows us to bring premiums down, not up, because businesses are paying for some of those costs today. And in fact, their premiums are probably disproportionately higher than they should be. So it's a very interesting phenomenon. When everyone is basically covered, it allows those premiums, I think, to be moderated over time. So I'm very optimistic that we're going to be able to control costs and improve access to care.
And if you can get us up to date on your understanding of this now, this isn't going into full effect until 2014, correct?
That's
so
correct.
Everything else will be the operating status as it is now, or how does that work out for everybody?
Well, but again, there are many aspects of this that people don't fully understand. In these first few years, providers are actually taking reductions in payment in order to fund the access improvement. So, for example, health systems and hospitals in this country anteed up about $155 billion of cuts that are helping to fund the access improvement that comes in 2014.
Let's talk about the Medicaid thing, because part of what you talked about with the emergency room care, some of the people now who maybe show up to the emergency room and can't afford to be treated and don't have coverage may be eligible now on the Medicaid rolls. Well, a big part of this ruling today was the fourth argument made regarding Medicaid, and it is that the states, I guess it's still allowed that the states have to beef up Medicaid and offer it to more people, but the government cannot threaten to withhold Medicaid funding if they do not. That was kind of the carrot out there, right? So my question is, will all states do that? I mean, are you worried that they won't offer that increased coverage because now they won't be penalized if they don't?
I think there's a lot we don't fully understand yet because the ruling just came out, but I think many states will really seriously think about the fact that if they can better cover everyone in their state, obviously that's a positive. And there are a lot of working people who don't have health care coverage. It's not just people who are out there, uninsured.
Yes.
Over 50% of uninsured people in this country are working Americans and often have two jobs but no coverage. So I think as people think about the political elements too, they're going to think about those individuals.
Nancy, we appreciate you taking some time to give us some of the insight that you have. Obviously, we'd love to talk to you more, but we need to get going. Nancy Schlichting, the CEO from Henry Ford Health Systems. Thank you.
Yeah, the president's going to be talking about this in just a matter of minutes, and we'll bring it to you live. Nance, thanks. Next on 7, the high